Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
Oh, Bob. Why, Bob? In our opinion, of course,
Brad,
Bob.
today we're going to talk about, if you have a stroke, if you have Parkinson's, or if you're elderly, or just some type of problem with your balance because something that you have, we're going to show you how to improve that and prevent falls.
And this is something you can do at home. You need to do it with someone, though, because you don't want to have a fall while you're practicing exercises that are going to help you prevent falling.
You want to have a belt on you and someone holding on to that while you're doing these so that way. Did you get a belt?
No, I didn't.
Okay, Lonnie's going to have to go get a belt. Sorry.
Okay.
By the way, while we're waiting for Lonnie to come back, if you're new to our channel, please take a second to subscribe to us. We have a subscription button over here or down here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
There you go. So with this, whichever disease you have, or if it's just a problem, whether it's a stroke or you have Parkinson's or you have a leg problem that is causing...
Our belt just arrived.
That's causing a gait or walking disturbance, so that, you ever see someone that when they walk, you just want to be by them because you think
Right.
they're going to fall, and actually oftentimes they will.
That's unfortunately my mom right now.
Sure,
Yeah.
and those are the people that are going to benefit from these exercises. So again, with two people with a safety gait belt is going to be very beneficial. And one thing that's going to be nice is you'll say, geez, I've been working these exercises for the last couple of weeks and I think the person's better, but you're really not sure. Well, we're going to show you a simple test that therapists use. It's a Bonafide test, and it's simple, very accurate. Take a chair with armrests, set it here, and I want you to measure 10 feet out. Our camera view is not large enough for 10 feet, so I'm going to pretend I went 10 feet out. Put something down. You can use a soup can. I'm using a cone there. 10 feet out, and then you got your timer, Bob. You're going to ask the person who's having the problem to say, in this chair, I want you to stand up, walk around that object, and come back and sit down. And you're going to time it, okay? As soon as the person's bottom leaves the chair, you hit go, and when they come back, and as soon as their bottom touches the chair, then you stop, okay? Ready, Bob?
Get ready.
Okay. So I'm going to go up. Going to walk, and oftentimes, if they need to use a cane or a walker, that is fine. Whatever they feel comfortable walking with. Boom. Okay?
10 seconds, 10.32 seconds.
Okay.
10 seconds.
A little over 10 seconds. It's important that the next time you test, after a couple weeks of our exercises, that you do the exact same distance, the same chair. Everything should be the same so you're consistent.
And there's charts, isn't there, that tell you, if someone is like less than, if it takes more than 20 seconds, they're at a high risk for falling?
Right.
They correlate those?
Right. And there's one for people with Parkinson's and after a stroke. There's norms on all those.
They've done a lot of testing on it.
Exactly. Yeah.
So,
in this case, you're going to test. You don't really need that necessarily. You're testing now compared to.
and see if you get any improvement.
Right.
It gives you some motivation for doing these.
Okay, the next step is go down. I just went to Menards. I bought this white trim.
Menards would be like Home Depot, big box store.
Yep,
that sells
hardware
home.
store would probably have it. Any kind of wooden sticks that you could have. And I put some pink tape on there so you can visually see it very easily, because you want to have vision involved with this. And I've got 4 of them here. For the first test, you only need, you can use all 4. I'm only going to put 3 out because we don't have enough floor space. We could put another one out, but that's all right.
So we're going to pretend you have a belt on, Brad, or do you want to put it on?
We'll put a belt on.
You want to put your mic maybe in your pocket?
I'll go right over the
Okay.
top of it. If you don't have a gait belt like this, just use any belt, as long as the person helping can put a hand on the belt, because if someone loses their balance and you don't have this on and you're trying to grab clothing or their arm,
You can even grab their belt. I mean, if they're wearing a
right,
belt.
if they have a good, good hefty belt, as long as you get your fingers in the belt a little bit.
Right.
Okay. Okay, so I'm going to be the person with the problem. If the person uses a cane, you can do this with a cane if they're not steady without it. So with or without the cane, and
I would normally hold on to them. I don't think I'll hold on to you, but I guess that goes without saying that I am holding on to you.
right, and
I'll do it for
Bob
them.
is not going to be pulling or tugging, just there in case I lose my balance. So I'm going to go with the cane and simply just step over. And this force, if the person is a foot dragger, this forces them. If they drag their foot, well, obviously it's noted, and they can't do that.
Yeah,
we
they have
do
to
not
work,
want.
they
Yep.
have to work harder.
And you can have the person turn around and go back. Real clean, nice steps. And then what I'll do, if that's going well, let's get rid of the cane then. And we'll do the same thing over, and they may be having some problems. And then sometimes if you want to get risky, or not risky, but advance the technique, go backwards. And have them look down so they can see what they're walking over and back. If this becomes too easy and they can go back and forth, then we're going to go to the next one. And actually these are not progressive, they're just different.
Yeah, and you could do side to side on this one too.
Good point, Bob, yeah. Because this can be a real challenge. And if you're working at a cupboard and you have to sidestep to the side and people get their feet hung up, this is a really nice one to practice with that.
And a lot of the elderly people have poor hip strength, and so when they take a step, their hip kind of goes like this. So you gotta, it's good to work on their strengthening too.
This is really good for Parkinson's. I like using it for Parkinson's. Stroke, because of the weak legs, and you need to focus on that weak side. All these are really good for all these diagnoses. Next one we're going to do is a square. Take the same 4 devices there, and you can do this differently. The first thing I'm going to do is be in the square and just standing there. And if the person needs a cane, that's okay to start with. And I'm just going to do toe touches out, over the line and in front, over the line and behind. This one they may not be able to do, but if they can, try to cross over here. And even for me, it's nice to have the cane. When it gets too easy, and make sure you do it with both legs, by the way. And then when it gets easy, you can take the cane away and then try it again. Okay? All the way over. That's a tough one there and back. This one, again, if it's too hard, don't worry about it. Just work the other 3. Okay? The next one, did you have something to say, Bob?
Nope, that all looked good.
I was going to go on to this one.
Oh.
So we step here, side step here, with or without the cane, depending on how challenging it is. Forward. And you notice we're always working 4 directions, because when you're in the house and you're walking around doing things, so many times you're just not walking in the line, you're getting around a chair, you're getting around, around the dog laying on the floor.
And we can tell you from experience that that's when people fall.
Right.
That's where they run into problems, is when they start going into different directions, a lot of times without their gait aid.
Exactly.
So, all right, next one.
Let's go on this line.
Okay.
You make a pattern like this on the floor.
These
are all similar patterns, but it approaches it differently.
Yep.
And there's different things you can do here. We can start here, have the person walk forward, and side step, go behind and to the right. So we're going forward and backwards, right and left, and doing a pattern. Okay. Make sure you go both directions. There.
Clockwise, counterclockwise.
And Bob, you had another one with this?
Yeah, a lot of people, especially with Parkinson's and maybe even a stroke, sometimes they have trouble taking tight turns.
Right.
So just going around this circle like this.
Exactly.
This is really difficult for a lot of people to do, to take that tight turn.
Yep.
And obviously you can switch and go the other direction.
And that's the exact same movement that you have when you get out of a chair in your house and you got to get up, maybe go to the bathroom, which is down the hallway behind you. You got to get up and make that tight turn. Very functional. Okay, there's one more I wanted to cover before we finish, and this is a straight line walk.
I'll put one back here, Brad.
And there are people, whether they have a stroke, Parkinson's, or they may have just tight adductors for whatever reason, you'll notice they kind of catch one foot like this, which puts you at really a big risk for falls.
And a lot of times with Parkinson's, they have trouble advancing their legs. They get that freezing, that frozen, where they freeze.
And it starts to go like this. It's amazing. It's a terrible disease. It's just. But I have one Parkinson's patient that when I do this, and he's forced to keep his feet apart.
Put this over here, Brad.
Oh, okay.
There we go.
Button it up in here.
There we go.
There we go. This all of a sudden takes it away. He can walk normal as long as he's got something between his legs like this.
This is a really interesting effect, and I have not tried this with a patient with a Parkinson. If you're a therapist out there, I'd like to have you try this and let us know.
I'd like to see how many people with Parkinson's have the same effect.
Yeah, they're able to walk better when they have a line that they're following it, in other words, between
Exactly.
their legs.
So it forces, because his feet always cross, and then when he turns, he gets one foot caught right here, and then the tremor starts, and you know
Sure.
exactly what I'm talking about if you have it or if you're a therapist. But when I do this with him, and he has his walker in front of him because he uses a walker, it just, everything goes away just like that. And but you can't have this functionally. What do you do with this? You have a line going throughout your house?
Well, you could tape a line throughout your house. You
I
know.
guess, maybe it would carry over to without eventually.
Right, you could tape throughout the house.
Sure.
But,
So
we'll call it the Heineck effect. Brad Heineck.
We're always working on things as therapists to help our
Improve
patients
things.
as well as everyone else. So very good.
Remember, we're not just pretty.
What are we, Bob?
We're pretty handy
Oh,
or
that's
helpful.
right. Yep. See, simple little devices like this. That's why we're not just. It's kind of like being
Something
ready.
is simple in this. All right, thanks for watching.